Today I will share with you about PreMalignant Vulva Lesion. Okay, we have a squamous cell carcinoma, the common one, the two type with HPV related and non-HPV related. Vulva intraepithelial neoplasia is with the related with the HPV related. Okay, the most non-HPV related is more common in the older one. So the diagnosis based on the keyhole biopsy and punch biopsy at the area of lesion. The lichen sclerosis is a non-HPV related with the pre-malignant condition. The commonest is at the age of 50 to 70 years old. The etiology is still unknown. The theory is because of hypoestrogenism state, and then it's a dry, and then associated with the autoimmune disease. So at the same time, it associated with the pernicious anemia, vitiligo, and alopecia areata. Okay. Alright. The presentation is a white plaque papules, and then area of erythema and ecchymosis and hyperkeratosis and pale excoriation. The scarring one is the extreme scarring, and vagina wall is a marrow, and histological we can see is a thin epidermis and loss of normal rete-pex, and edema of the mist and basal layer vacuoles changing, and presence of melanocyte. The risk of malignancy about 2 to 6%. Right, the treatment is it possible to spontaneous resolution. The surgery is a local excision or laser ablation, a cardiotherapy or valvectomy. Medical treatment, the first line is a topical super potent corticosteroid ointment. Right, is the most effective one. Other is a topical testosterone retinoid tacrolimus. Right, is a supportive care. Extramammary paget disease is a rare neoplasm associated with the apocrine gland. Most common in the vulva, scrotum, and perineal region. Other apocrine region is epidermal associated other epicrineal, also known as adenocarcinoma in situ in vulva, age about 15 to 80 years old. Presented with the pruritus also is a burning and irritation and pain and swelling. Alright, the clinically we can see so well the demarcated erythematous with leukoplakia plaque, typical like cake icing effect or crusting, scaling, ulceration. Histology is a large intraepithelial lesion with the abundance of cytoplasma and large vesicular nuclei, and hyperkeratosis and parakeratosis and acanthosis. The difference between the between the extramammary paget and lichen sclerosis, a thin epidermis and loss of rete, and this one is a large intraepithelium lesion and abundant with cytoplasma. Right, this is one the HPE. And then okay, the treatment is a surgical incision and radiotherapy if unfit for surgery, and topical 5 fluorouracils, but not curate, for symptom relief only. Okay, about the vulva intraepithelium neoplasma. So the characteristic is a abnormal proliferation of cell with increase of nucleus cytoplasmic ratio and nucleus hyperchromatosis and pleomorphisms and mitosis. Alright, the type of, we have two type, usual type and differentiated type. Okay, the usual type is a HPV related. The non-HPV differentiated type is a non-HPV related. So the usual type have Wati and basolite and mixed. What the different? The usual type is a common happen at a young age, known as a Bowen disease. Okay, the Wati is a like condylomata appearance, and the basolite is a flat and non papilloma appearance. Okay, we don't have actually VIN1, VIN2, VIN3, because we abolish this category. VIN1 is not pre-malignant, and VIN2, VIN3 is under usual types. The usual type, they present with the pruritus, about 60% pruritus, pain, ulceration, and dysuria. Histology is a thickened and hyperkeratosis and parakeratosis. Epithelia is enlarged, high nuclear and cytoplasma ratio with the mitotic figure, right? our aim is to obtain the full biopsy and relieve the symptom, restoration, normal epithelium architecture, and reduce risk of malignancy and cure. The surgery we do is a white local excision or laser or LEEP, vulvaectomy if indicated. Okay. Medical therapy, we have a topical 5-fluorouracil. The response rate is very low. It's about 30%. Failure rate is about 88%. Alright. Another one is imiquimod. Imiquimod is a limited use. Response is about 47 to 80%. Another one is interferon. It's a limited use and it's costly. Photodynamic therapy is one of the method of therapy, use of photosensitizer and photosensitive agent. Okay, differential type of VIN, known as intraepithelium carcinoma of simple types, is the most common in a postmenopausal woman, age about 67, more than 67 years old. Actually, associated with the lichen sclerosis commonly. So the cellular is a cellular abnormal, less prominent compared to usual. Alright, main mistake with the benign. Okay, the clinically we can see the area of red lesion, ulcerative erythematous with a white grey discoloration. More likely progress to invasive carcinoma compared to usual VIN. Radical surgical excision is a indicate for this patient, and medical is ineffective medical treatment. So the characteristic by histology is we can see the increased amount of eosinophilic cytoplasma in this plastic cell with above the basal cell layer. Alright, that's all about the PreMalignant Vulva Ca. Thank you.